Hello, well, my name is Jacqueline Turner. I'm working as a genetic counsellor in the Mater Hospital in Dublin, Ireland.
What exactly is genetic counselling and why is it important?
So genetic counselling involves meeting individuals and their families who may be affected by a genetic condition to explain what the condition means, its prognosis and its treatment. Most genetic conditions can be confirmed by finding a gene which is responsible, and therefore you can determine how the condition is inherited and what is the likelihood of other children or siblings being affected. Once you know the gene and the gene change, by looking at the family history, you can organise testing of other affected family members to see if they have the same condition. Or you can organise testing for other at-risk, unaffected family members to see if they carry the gene. People are ready for the new gene therapy treatments when they become available down the line.
In which situations should someone consider seeing a genetic counsellor?
It is important to have and to seek the genetic information as soon as the clinician suspects that the condition is inherited. There are some gene-specific treatments on the market, and treatment should be best started as soon as possible.
What should patients know about the counselling, or how should they prepare for it?
The genetic counsellor will ask about eye conditions that are affecting other family members in the family, especially where there has been a loss of vision at a young age. Genetic counsellors also assess the family for other potentially genetic conditions, so that if a relative has died young or needed medical treatment, the genetic counsellor will ask what condition they had, the age they developed it, and where they had been treated.
How can genetic counselling help individuals or families make informed decisions?
Genetic counselling outlines options available, and each option is then discussed in detail. It becomes clear throughout the discussion which options a person would consider. It is important for the genetic counsellor to know that you have considered carefully all your options and you've made the choice that's right for you.
Which emotional challenges or considerations often come up during genetic counselling?
Genetic counselling is about listening to the individual, seeing where they are at, and then signposting them to the support they need. Some individuals need more support than others. If I feel somebody needs more emotional support, I'll usually bring this up sensitively during the session and offer a referral to counselling sessions. Some people need more practical support in the work or at home, or to allow them to get out and about. Some just need a listening ear. They may have started to feel helpless and dependent. When I meet someone with visual loss, I try to offer them some hope. There is so much more to a person than having good vision, and they need to be considered all that they can offer.
What future developments or innovations in genetic counselling are you most excited about, particularly in the area of rare diseases?
Well, we're just at the beginning of our understanding of rare diseases. We're getting much better at making a diagnosis, but less able to understand why a person's condition may be worse than other people's with the same condition, or why one person in a family gets a condition while another person with the same gene change in the family does not. I'm very excited also about the greater collaboration between clinicians that the ERN brings. Collaboration will also help the research community to learn more about rare diseases, which will help them devise new ways of treating them.
Hélène Dollfus, I'm the coordinator of ERN EYE. In my daily practice, I'm an ophthalmologist and also a medical geneticist. And I must say that the genetic counselors are essential partners in our activity in genetic ophthalmology. They are really close to the families, but also close to the medical teams, and they are an essential link between the clinical medical activities and genetic counseling we deliver to the families and the patients.
What is the role of a genetic counselor in a clinical setting?
Practicing genetic counseling in genetic ophthalmology is really an essential part of our work, and the genetic counselors are major actors in the care of the patients. and their families. This ranges from prenatal diagnosis to genetic counseling for children, for future pregnancies, family planning, and also the importance of delivering genetic testing to patients.
As a physician, how do you collaborate with genetic counselors?
A genetic counselor, they are really very important to us and for the patients. We work hand in hand daily with them, and they are able to really guide the patients in their pathway, the genomic pathway, explaining to them what means a genetic testing, also helping us in the explanations we can deliver to the patients. This means that they can give a different perspective of what means a genetic testing, what means the result, what it implies for the family planning. They help us very much in the family history of the patients and also in the genomic pathway of the patients, from the prescription of the genetic testing, the explanations of the different aspects of this testing, and also how to understand the results of the test, what it means for the patient, what it means for the family, what it means for the family planning. They are really major actors in our daily practice, and we rely very much on them for the patient care, but also in the medical team.
Hi, my name is Susana Carvajal. I represent a federation of rare genetic kidney diseases, different associations, different countries in Europe. For us, the screening, the newborn screening, is an opportunity to detect chronic kidney disease, what is really important for our association because it's a pandemic now situation. There are a lot of people who reach the kidney failure without knowing why they reach this final stage of the life of a kidney. So, but why is for us the genetic counseling is really important because we, as a hereditary group of the rare diseases, we know that not on all, but most of the diseases of this situation, behind this motive or cause of this renal failure, there are hereditary disease. That's why genetic is really important in order to detect these diseases. Why is important that? To have a good treatment and to extend the life of the kidney for patients.